Hey everybody, it's Doc Bradley. Welcome to October, which is Breast Cancer Awareness Month. As you know, breast cancer awareness is a 365-day per year endeavor, but I want to talk about the critical things we all need to remember in terms of screening, resources, and treatment. So let's get into it. Welcome to October and Breast Cancer Awareness Month. I really want to take a moment to just speak to you very, just hopefully conversationally, and have a great discussion regarding breast cancer awareness. For me, this is by far the most important topic that I speak about, whether in person or on social media. Most of the people who I know who have succumbed to breast cancer or had a very difficult course in terms of treatment and recovery have been family members, friends, and neighbors. And so for me, it's very important every day of the year to emphasize breast health, breast cancer awareness, prevention, resources, and to serve as a point of service in regards to breast cancer awareness. So, most importantly, the great thing about breast cancer across the world is that the survival rate has steadily improved over time. Right now, the average 5-year survival rate for breast cancer is about 91%. And that has improved from anywhere from 40 to 50% survival rate in the 1970s. So we have made great improvement in terms of survival. And most importantly, this is because of breast cancer awareness, education, screening, and also improvements in therapy, such as hormone related therapy like tamoxifen, also aggressive treatment associated with metastatic breast cancer, so breast cancer that has gone outside of the breast and the lymph nodes, so bone, brain, different locations that are remote from where the breast cancer arises. So we've made great strides in terms of treatment and survival, but we still have a way to go. Also, there are still disparities in terms of breast cancer survival and complications with Black women in particular. In some instances, there is a twice likely or twice the mortality rate, or twice as likely for Black women to die in association with breast cancer. So one of the reasons is because Black women have a higher risk of being diagnosed with a more aggressive type of breast cancer known as triple negative breast cancer, which means that the hormone receptors on the breast cancer tumor cell do not respond to the hormone therapy that's available for breast cancer. So it's very important that no matter what your demographic is, no matter what your age is, that you know your family history, that you are seen by your healthcare professional annually so that you get breast exams, that you're performing your monthly breast exams at home. If you are still getting your period every month, it's recommended that you do your breast exam approximately 7 to 10 days after the onset of your menstrual cycle, when the engorgement and discomfort associated with your breasts and your period have subsided. You want to make sure that you do at least part of your breast exam in a mirror so you can take a look at your breasts. You want to also look for any changes in symmetry, seeing if one breast is bigger than the other. Everybody has some asymmetry, but you want to look for differences in your breast size. You want to look for any dimpling or stippling or thickening of your skin. You want to look for any retraction of the nipple or the areola. You want to make sure that the nipple and the areola look the same on both sides. You also want to make sure that you're doing part of your exam standing up or sitting up, and the other part is laying flat. So you want to examine all quadrants of your breast and make sure that you're examining your armpit. Make sure that you examine underneath the areola and the nipple. Um, and you want to make sure that you are consistent with doing your breast exam. Oftentimes, what we see as healthcare professionals is people will see a news report like do a breast buddy exam where you're doing your exam alongside a friend or family member that you guys kind of dedicate to do your breast exams at the same time and check in with one another to make sure you're being consistent. And what happens is that people aren't doing their breast exam every month. And then, of course, most people, their breasts are lumpy, bumpy. And so we usually get a surge in evaluations in the office because people come in after Breast Cancer Awareness Month and they haven't done a breast exam all year. And now they have found something of concern when in actuality, this is just their normal breast exam, but they're just not familiar with it. So it's really important that you are consistent, that you do your breast exam every month. Now, if you no longer get your period and you're going through the perimenopause or the menopause stage, then you want to pick one day of the month, either the 1st, the 15th, whatever it is, mark it on the calendar and make sure that you do your breast exam that day every month. And once again, doing at least a visual inspection. You want to do all quadrants of the breast, the upper outer, the upper inner, the lower inner, and the lower outer. You want to make sure that you're, when you do your breast exam, and I'm going to see if we can find a video or a schematic and put it here, where it shows you want to go in a circular fashion. And you want to make sure that you're not doing a lot of lifting and moving, because sometimes the breast mass that you find is very tiny. And if you're constantly lifting and going back down, sometimes you can miss very small or subtle masses on your breast. The other thing you want to look for in terms of risk factors are new onset nipple discharge. There are some people who always have nipple discharge, or you may have other issues going on with your breast that may cause the nipple discharge. But any changes in the size, the color, the visual appearance of your breast, new onset or change in your nipple discharge, you want to notify your healthcare professional. Also, once again, make sure that you're checking your armpit because sometimes the first sign of breast cancer or any other type of breast disease can be enlarged lymph nodes. The other thing is, if you find a breast mass, just know that that does not absolutely indicate that you have breast cancer. So it is definitely something that needs to be evaluated, but please make sure that you're doing your breast exams every month so that if there are changes, you notice right away and you can call and notify your healthcare team and get in right away to get a study. Normally, we start with a screening mammogram for people without any symptoms, and a screening mammogram means that it's a x-ray of your breast tissue, and we look at everything, your entire breast mound, the skin overlying the breast, the muscle underlying the breast, and we evaluate for any abnormalities. Now, a diagnostic mammogram means that you have indicated that you have symptoms, or that you or your healthcare team have found a suspicious area on your breast. So the diagnostic mammogram is going to focus in on that area of concern, but it's also going to evaluate the rest of your breast tissue. The other thing that may be done is an ultrasound to look at the size and consistency of any masses that are detected. And also possibly you may have a breast MRI depending upon your personal history or what they find on the mammogram. So risk factors for breast cancer. There's a number of them, and just to make sure that I don't miss any, we're also going to put a list of risk factors up here on the screen. But personal history of some types of benign breast disease, and also any your personal history of breast cancer. Also, breast cancer in a first degree relative, so a child, a sibling, or a parent. Also, if you have a history of obesity, if you have a history of taking hormone replacement therapy, if you have a history of smoking, and there's some other risk factors, and I'll make sure I list them here because breast radiation to the breast or the chest. So there are a number of things. Also, if you have a family history of BRCA1 or BRCA2 gene mutations, there's also an increased risk of breast cancer. So just take these things under consideration. But one of the major things that we need to do annually is to make sure that we're getting our physical exam done. We're talking to our healthcare professional on whether or not we need to start screening at age 40, which is the average. Or in some instances, if you have a personal history of specific types of breast disease, or of course a history of breast cancer, or if you have a strong family history of breast cancer, or exposure to certain drugs or radiation therapy, they may advise that you start your breast cancer screening early. So I know we talked about a lot, but I wanted to make sure that we're covering all of the major issues that could impact your risk of breast cancer. So let me know in the comments if you guys have any other concerns, and we will pick up on a couple of other things in another post. Make sure that you're following me on the other social media platforms listed here, and I'll see you guys soon. So make sure that you look at, also I wanted to provide a list of free and affordable mammograms for those of you who are uninsured or underinsured. So we'll list that, and take care, and I'll see you guys soon. Peace.